Hi, my name is Madeline. I'm gonna help make a video for you guys so that you can follow along with the manual lymphatic drainage based on the packet that your therapist might have given you to help move fluid either from your arms or from your legs. Today I'm gonna focus on leg swelling. So I just wanna go over some of the principles first just to keep in mind. So you want to try to do this at least 1 to 2 times a day if you can. If you are wearing compression, which your therapist would have told you, you want to put this on after you do the massage. When you're going through your packet or as you're following along with me, each stroke or each point that I do, I'm gonna do it 8 to 10 times. We want to make sure that we're using light pressure and we're stretching the skin, not just sliding over the skin, and I'll go through that as I'm doing it. We're going to talk about certain directions, so just listen to what I'm saying and follow along for the direction that you're going to push the skin. You want to make sure that you're stretching the skin and then letting it recoil or letting it rest and giving it about 1 second of push, 1 second of rest. And if you do have any pain or discomfort while doing this, stop and let your therapist know. So like I said, today we're going to focus on the legs. So if you remember back when you did this with your therapist, you start up at the neck if that's appropriate for you. Your therapist would have told you if it's not. So we're going to start at the neck, we're going to move to the abdomen, and then we'll work on what leg that we want to focus on depending on where your swelling is at. So I'm just following along in the packet. You don't have to, you can just watch this video and go along, but I'm just going to make sure that it's the same as what you've been instructed by your therapist. So if your therapist has said that it's appropriate to start at the neck, we're gonna start on the side of the neck. You can cross over or you can stay on the same side, but you wanna flatten your hand and you're gonna go backwards and down, stretching the skin, and then you release. So back and down, release, and you're gonna do that about 8 to 10 times. So back and down, back, down, back, and down. And then I'm going to repeat 8 to 10 times on this other side. Notice how my hand is nice and flat. I'm not getting too pokey with my fingers, and I'm stretching that skin, but I'm being gentle. After you've done the side of the neck, then you're going to move to the collarbone. So you're going to find your collarbone or your clavicle, and you're going to place your hand right over it. So this part of my hand is going to be resting on the bone. The rest of it melts on that skin right at the top of your shoulder. Your motion for this one is going to be a back and then in. So back and in towards the neck. 8 to 10 times. Notice how I'm letting it go. Once you do 8 to 10 of those, you'll switch to the other side. My speed might be a little quick, so feel free to pause and finish your 8 to 10 and then hit play when you're ready for the next one. I'm not necessarily doing all 8 to 10 just for the purpose of the video, but you do the specified amount to make sure that you're getting the effectiveness of this massage. So I've done my neck, I've done my collarbone, so now we're ready to move to the abdomen. So the first part of the abdomen, we want to find your belly button. If you want to do this standing or laying down, that's okay too. I'm just doing this in sitting for the purpose of the video, but you're gonna find the sides of your belly button and you're going to think about scooping up and in and then letting it go. Scooping up and in, letting it go. 8 to 10 times. You can also do this one hand at a time if 2 hands is too much for your shoulders. And then once you finish that, we're gonna move to some diaphragmatic breathing. So your therapist has probably told you a couple different ways for how to do that breathing. I like to think about the rib cage and thinking about your ribs being an umbrella. So if you don't have any air in your lungs, that's a closed umbrella. If you think about inhaling, you want that umbrella to open. That base of your ribs is like that umbrella. And then exhale, close the umbrella. So the first part is to get your breath. Then you're gonna add some pressure on your tummy. So when you inhale, you're gonna feel it rise. On the exhale, exhale through your mouth and provide a little pressure in. You're just moving with it. You're gonna do 5 of those. If you need to pause and do the rest, go ahead and do so now. So now that we've done the neck and the abdomen, now we're gonna start on our bridges. So for this example, I'm gonna say that my right leg has some swelling. So if my right leg has swelling, that means that I need to help direct this fluid somewhere else. So I'm gonna work on the right side armpit and the left side groin, because I know that I can call on these areas to help out this leg. Let's say that it's your left leg. Then we're gonna call on your other side groin and your left side armpit. So today I'll be doing this one. So let's go back to that. So if this leg is swollen, I'm gonna work on this armpit and this groin, okay? So I'm just gonna start here because this is where the packet starts. If you wanna put your arm up, you can. Put it behind your head or just kind of hold it here. You're gonna start in your armpit and you're gonna think about pumping up. You can also do an up and an in motion. You're opening up the nodes that are in your armpit 8 to 10 times. And then you're gonna build that bridge from here to here so that that fluid knows where to go. So you're just gonna move about one hand width down. For this, you're just gonna pump up towards that armpit where we just woke up those lymph nodes. 8 to 10 times. Wherever your hand left off, you're just gonna try and pick up and move to there. I'm on the side of my chest or the side of my trunk. If you can't reach all the way, just go to where you can reach. 8 to 10 times. I'm gonna move down again. 8 to 10 times until I reach the hip. So I've built that bridge from my right hip up to my right armpit. One more time, right in that crease. And then I'm done here. So then what I'm gonna do is I'm just gonna go right here on the hip, kind of scooping up and in towards the belly button. And then I'm gonna go to my opposite side hip, wake up those lymph nodes in that groin. So kind of that up and in towards the belly button on that side. Then to build my bridge over to here, I'm gonna start near the side that's not affected, and I'm gonna pump across my pelvis towards the side that's not swollen. 8 to 10 times. If you need to lay down for this, that might be easier. And then one more hand over just to connect hip to hip. There's that analogy of thinking about moving the front cars, move the middle cars, move the back cars, since this is our affected side. We did the same thing up here previously. We moved the front cars, we moved the middle cars, and we moved the back cars. So now we have our two bridges. Now we're ready to start on the leg. So you're gonna start on the outside of the thigh and you're gonna open up this because this is kind of like our detour route for that fluid to move. So you're gonna start on the side of your thigh, here on the outside, kind of on the side of your buttock, and you're gonna think about pumping back towards that butt region. You can also have your hand across if you need to, or you can just have the same side hand. And my hand ends here, and I'm gonna pick up and move. If you're like me and you have bigger hands, you might not need to use that many hands. If you have smaller hands, it might take you more times to complete your leg. 8 to 10 times until you reach the base of your knee. Once you're done opening up the outside of the thigh, you're gonna come and do the inside and the top. So you can do same side hand or you can do opposite. I'm gonna use same side. You're gonna scoop up 8 to 10 times. And then within that same line, I'm gonna go to the top and I'm gonna connect. Because we just opened up here, now I'm gonna connect that area. So since I worked here and here, I'm gonna go down one hand width to the middle of the thigh. Same thing, I'm scooping out towards the outside. Then I pick my hand up to do the top part of the thigh. 8 to 10 times for both of these. Then moving down to that inner part of the knee, right above it, 8 to 10 times. And then the top, 8 to 10 times. That's the thigh component. Then we're gonna move on to the knee. So there's a few parts to the knee. The first part, you're gonna work on the top part of the kneecap, right on the kneecap, and right below the kneecap. So that looks like this, pumping up 8 to 10 times, and I'm right above the kneecap. Notice how my skin is stretching and then I let it go back. Then you're gonna go on the kneecap and you're just moving that skin 8 to 10 times. And then below the kneecap, 8 to 10 times. Notice how my skin's not getting red. If you notice your skin getting super red, maybe adjust your pressure a little bit. Sometimes you can turn red if your skin is more sensitive or dry. So just watch your pressure and make sure it's not too much. So I did above, on, and below the kneecap. Now we're gonna work on this segment right on the inner part of the knee. Sometimes fluid can pocket here, so we wanna make sure that we're getting that area. And you're doing a scoop outward motion. You can even do a push with the other hand if this motion hurts your shoulder. But you're directing it out, okay? The last part for the knee is gonna be behind the knee. So this is a little bit harder to see, so I'm gonna show you what my hands look like. So they're nice and flat and they're together. And I'm gonna do an up and back towards the buttock region. You don't wanna be too pokey with your hands like this, because that's gonna hurt the back of your knee. Hands can be nice and flat. You can also interweave them a little bit if that helps. So again, that motion is up and then scooping back towards the buttock. So if I'm here, I'm gonna go towards you guys, and then I'm sliding back towards the buttock, and then release. Up and back and release. 8 to 10 times. So those are working on those lymph nodes right behind the knee. When you're done with those, we're gonna move to the lower leg or the calf. So we have a front part of the shin and we have a back part of the shin. If you notice that you can't cover the sides, if you just have a bigger calf, that's okay to add more to the sides. For today, I should be able to cover the front and the back with the techniques I'm using, but always add in more if you feel like you need more to cover the area of your calf. So for the front part of the calf, you're gonna have that one hand, whatever hand you choose, and you're gonna do a pump up motion towards the knee. We're trying to direct that fluid up away from the toes, 8 to 10 times. And then you're just moving each hand width down until you reach the ankle. 8 to 10 times each time. And one more here for me, 8 to 10 times. You can also do this sitting more upright with your legs out in the bed if that's more comfortable. You could also cross your leg and use it here as well. Completely up to you with what you can do. I'm gonna move back to here. So we accomplished this area. Now we're gonna look at the back part of the calf. So you have a little bit more muscle, a little bit more sliding here. That's okay if this moves more than here. Just still try to have that same pressure. I'm gonna have my hands in the back like this, just to kind of cup that area. So I'm gonna start at the back part of my knee crease, and I'm gonna pump up and release. Pump up, release, pump up, release, 8 to 10 times. And then I'm gonna move my hands down, still using that 2-hand technique, 8 to 10 times. And I've pretty much covered the front, the sides I was able to get just with my hands, and then the back at the same time. If need be, let's just say I have a bigger calf, you can come and put your hand on the sides, starting up at the top, working your way down, so that way it feels like you've covered the whole part of your calf. But that's just if you need it. So then we're gonna move to the ankle. So you have the front part of the ankle and you have the sides of the ankle. So for the front part, you're just going right in that crease. If you were to bend your foot up, you're just placing your hand right in the middle and you're pumping up 8 to 10 times. Again, if this hurts your back to bend over or you just don't have that mobility, maybe try crossing your leg or try this laying in bed and then sitting up with your back against the headboard with your knees a little bent. and then I'm gonna move to the sides of the ankles. For here, you can do a pumping up motion. You can also go right near the ankle bones and do more of a C curve or a J curve up and around the ankle bones. But if that's too complicated, just do a pump up with your hands kind of melted over everything. Once you've done that for the ankle, we're going to the foot. So top of the foot here, pumping up. Again, that skin should stretch 8 to 10 times. And then we're gonna move to the toes. For the toes, I'm gonna cross my leg just because it's a little easier for me to do. You're gonna think about making a circle with your hands, and you're gonna put that around the toes. If I show it on my finger, it's a little bit easier, but you're gonna start at each knuckle, pumping away from the toenail 8 to 10 times, and then you just move up to the other knuckle. And you can do it on the knuckle that has the nail, it's just a little bit harder. So for the toe, pumping away from the toenail. And then if you need to go to just a 2-finger or a 3-finger, you just adjust based on what feels right to you. And then you're doing that 8 to 10 times, each knuckle on each toe. And then that completes the leg segment. You'll notice that if you're following along in the packet, it talks about once you get down to the toes, you should go back and clear that center system again. So that would mean going back to steps 1 through 4, or if your therapist said not to do the neck, then you would do steps 3 and 4 only. So we're just gonna assume that you're allowed to do all 4 steps. So that means you would go back to that very first one, that back and down on the side of the neck, 8 to 10 times. You would do that on both sides. You would find your collarbone. You would take your hand and place your hand here on the collarbone. The rest of your hand melts on that muscle here, and you're going back and in 8 to 10 times. Same over here. Find that collarbone, back and in 8 to 10 times. Step 3 was find your belly button, have a hand on either side. You're gonna do that scoop up and in 8 to 10 times. And then last but not least, we're gonna go back to that diaphragmatic breathing or that balanced breathing, thinking of that rib cage being that umbrella opening and closing. On the exhale, giving a little pressure up and in, similar to that scoop. For this one, just doing 5 of these. And then once you've done that, you've completed your segment for your manual lymphatic drainage for your affected leg.